You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We've had him on the program before. In fact, he is Alaska's go-to implant dentist, Dr. Guy Burk. Dr. Burk, welcome back to the program.
Hey, great to be back again, Randy.
Now, you brought a stack of photos, so we'll try to get to as many of those as possible. Now, for people that don't know your practice, like who's the typical implant patient that you see?
Well, I don't have a typical implant patient, but most people fall into one of two categories. The first set of people, they've been to the dentist, they've had a lot of dental work. Some of these people have spent tens of thousands of dollars in the dental chair, but nothing they ever do seems to work. It's problem after problem. Maybe they started out with fillings and then they turned into crowns. They had some bridges, maybe the bridge failed. They had a root canal or two along the way, maybe the root canal failed. And at some point, a dentist tells them, I think you should think about pulling some of these teeth or pulling all the teeth and getting dentures. And they don't want to have dentures.
So they go to you because they don't want a denture?
Yeah, that's why they come to us. They don't want to have dentures.
Okay.
So, yeah.
Now, what's the second group?
Second group of people have been in dentures. So, these people had all those same problems, and at some point they took the plunge and they got dentures. And for a lot of these patients, that was the end of their dental problems for a while. And they wore the dentures for a while, but what people don't understand about dentures is when you take the teeth out, you start losing the bone. And they might do okay for a while, but eventually they start to have a lot of problems.
They get loose?
They get loose, the bone goes away. It's not the denture changing, it's their face changing. Your face goes away. And
starts to sink in?
Absolutely. So that's kind of a secret, right? Is like that we know as dentists, but a lot of patients don't understand, is that dentures actually cause bone loss. They cause accelerated bone loss because they're unstable, they're moving around, and the bone goes away.
Are there a lot of people in Alaska that have dentures?
Yeah.
An upper or lower denture?
Yeah, absolutely, especially in Alaska.
Like thousands?
Thousands and thousands. We could fill the Sullivan Arena, which is an arena up in Anchorage that we have, 4 times just with people in Anchorage who don't have any teeth.
Now, we talked on the phone, knowing you were coming out, you said a lot has changed with technology. I guess you have an implant-only center. I mean, this is kind of your focus.
This is all we do. This is the
Now, we had you on here about 4 years ago. So what's changed? Like, what's the biggest changes?
Well, number one is my appreciation for what this does for people's lives.
Okay.
It's incredible. So my patients tell me, I get to interview them a year after they've had this done, and they tell me it's changed everything about their lives. The way they interact with people, maybe they got a new job. A lot of these people find love after they've had their teeth because they're confident now. Absolutely. It's every aspect of their life. They'll tell me that every aspect of their life has changed from having this procedure done.
So how old can you be to get this done? I think I asked you before, what's your oldest patient?
My oldest patient was in their 90s. Yeah.
Why would a 90-year-old want to do this?
Well, because they want to eat. When you're that age, Randy, your life very much revolves around spending time with your kids, your grandkids, your friends, and they go out to eat. Food is a big part of their life.
Aren't they more likely to fall out if you're 90 years old?
The dentures?
No, I'm talking about implants.
No, absolutely not. So as long as these are done the right way, okay, and they're engineered the right way and the implants are put in the right place, especially when you're in your 90s, I can almost guarantee they're going to last the rest of your life.
Okay.
So if you're in that age category, I only need to buy myself 10, 15 years or whatever. So no, the older you are, actually, it's the people who are very young where I might say, you might redo this once in your life. If you're getting this done in your 30s, even if I do it really, really well, it might be redone. If you're in your 90s, that's probably going to be, I tell those patients, it's probably going to be the last time they ever get their teeth fixed.
Is this one of those things where they go, I should have done this years ago?
Every single time. So, they just don't know what they don't know. They don't understand how good life can be when you have teeth. Like, here, let me tell you something about your life if you're a denture wearer, Randy. So, you go out to eat, and your menu is about this big. This is about the number of things that you can eat on the menu, because you can't eat chewy crust on your pizza, you can't eat bread, pasta al dente. They have to be very selective about what they eat in front of other people. So eating in public is a huge deal. So when they now have teeth that don't come out, they can go and eat whatever they want on the menu.
And do they?
Absolutely. They'll send me pictures of what they ate the day after the surgery. They'll go out and eat whatever they want.
So you said you did this for a 90-year-old?
Yeah.
Like upper and lower teeth?
Upper and lower teeth. Same day. They had teeth the day that we did the surgery.
Is that right?
Absolutely.
And so when a 75-year-old or 70-year-old goes in your office and says, Doc, are you sure I'm not too old?
I
so
tell
it's not even close.
Patients come in and they say, well, I don't know how much longer I'm going to live. But the thing is, when you get to be that age category, why not live your best life at that point? Eat what you want. My 90-something-year-old patient, he lived for another couple of years, and those teeth were the best thing. I feel so good about that case because that patient was so happy. They were smiling. Their life, I feel like they had double the life from the time they had those teeth on.
Right? Okay.
Absolutely. They loved them. They would send me messages just about how much they loved their teeth, showing pictures of themselves smiling. And so I really feel like I helped them. It was them who did it, but he got to live so much more life in the last couple of years of his life.
Nice.
And he was so happy with his teeth. He loved them.
Now, I'm not trying to side with you, by the way, on this interview. I'm just asking the questions. But I guess what you have going on there is quite unique. I mean, you do, I guess how implants, correct me if I'm wrong, how dental implants are typically done. You go to one doctor's office that does the surgery, another office where they put the teeth on top. They send everything out to a lab. You do it all right there.
Absolutely.
I mean, you print their teeth
so I do
in the next room?
the process I call design build, kind of like design build for a home, right?
Okay.
So the traditional way to do this is, you have a general dentist or a prosthodontist. They do the architecture work, they design the house or whatever, and then they'll send it to an oral surgeon who does the surgery, and then they use an outside lab to do it. And there's nothing wrong with doing it that way. That is the way that most people do it. But I've found that when you can combine all of those things under one roof, we get to the end faster. We have better, more predictable results. And since you only have one person who's responsible for doing everything from start to finish, I can make sure that they're always happy with the final product, because if they're not, there's only one person to point the finger at. So I guarantee my work, and I make sure that the patient doesn't get teeth until they're very happy with whatever we do.
So if the smile is not to their liking when it's all done, you could literally press a button and make a new set of teeth.
We mill them a new one.
What we're talking about today, you teach other dentists.
Yeah.
Is that right?
Yeah. Yeah, I'm actually doing a training this year. We're going to be taking on a bunch of dentists and teaching them intro to dental implants, but also digital dentistry. We'll be teaching full arch implants. Just did a presentation down in Phoenix to 60 big docs that
Now,
do.
full arch implants means like 4 or 6 implants.
Teeth that are bolted in your mouth. So
that
permanent
don't come
implant
out.
teeth that don't come out. Yeah. I'm really passionate about that.
Great. Now, you brought some photos. What are we looking at here?
Oh, absolutely. Okay. Well, this is the first patient right here.
All right.
And he told me that for 40 years, his smile looked like this.
Okay.
And so he pretty much hasn't smiled for 40 years. And the thing that finally got, he's wearing a partial. He doesn't walk around like that normally, but that's the way he looks when he's at home, unless he absolutely has to put in the partial. One of the things with partials is they're very difficult. Sometimes they're loose. Food gets stuck underneath them. They can be quite uncomfortable. And so patients don't love their partials. I've met very few patients who say, I love my partial. When they smile, they show metal a lot of the times. It can be uncomfortable. So a lot of them take it out any chance they'll get. So this is the way he is at home, or anytime he doesn't need to have his.
So his option would have been a denture.
Yeah, take it out and put a
before.
denture in. Yeah, absolutely.
Okay.
Yeah. So he got tired of that, and so eventually he finally came in. And one of the things, for some of these patients, the thing that makes them finally step up to the change is they'll go out on a date or something like that, and they're not confident when they're out on that date eating or whatever, and so they'll feel like they have to take their go to the bathroom and take their partial out and clean underneath it. Or absolutely. So I think that if you have teeth that don't come out, they're your teeth again. It's like having your teeth.
Okay.
Pick whatever you can on the menu, but it makes you confident. So some of these patients go out and they go on these dates, and they're like, the teeth are everything.
So they tell you this?
Absolutely, yeah. Some of these patients got married after they got their teeth because they met their life partner. They were confident.
Because of their confidence.
They were smiling.
Okay.
It's not just about what they can eat on the menu, but it's also the confidence of smiling on those dates. If you're smiling like this, well, that's not very friendly, right? So, when people smile, it changes the entire conversation. It's not only you smiling, you're making everyone around you smile. But if you're not confident in your teeth, it changes the entire interaction.
Now, is this the happiest? 'Cause look, I guess your wife is a dentist.
Yeah.
You were raised by a dentist.
Yeah.
You talk about dentistry all the time. But is this, because I guess you focus on implants, giving new teeth with implants, is this the happiest group of patients? Like much happier than your wife's patients?
I've had the opportunity to do every kind of dentistry. So I had a big 6 dentist practice, and all of the kind of major work got kind of funneled up to me. So I would do full mouth rehabilitation. I did orthodontics. I did, cosmetic fillings. I did lots of dentures, tons, which, those patients can be very happy when you give them their denture for the first time. But I've never met patients where it is as much of a quality of life jump as this. It is truly life-changing. When a patient decides to take control of their life and get their own teeth back, everything, they're telling me everything in their life changes.
Yeah, but if you have bleeding gums and gum infection, bad gums, can you still do this?
Absolutely. Those are the best people to do this.
Really?
Yeah, absolutely. Like, let me tell you a story.
And the implants will stay in there even with bad gums?
You don't have bad gums anymore. That's one of the benefits. So actually, one of the things that happens when patients who have chronic bone loss and they have bad gums and bad breath and things like that, and they come in, they're missing a few teeth, one of the things I have to tell them is, hey, I can put implants in there, but the sick teeth next door are very likely to cause your implant to fail in the next 5 or 10 years. So if the house is crumbling, we're not going to put a new kitchen on it, right? So when we do a renovation, we do the same day. By the way, my best friend is in orthopedics, right? He thinks we're crazy because I got patients that come in, every tooth's infected, they've got bone loss, they've got a bacterial infection around everything, and he's going, you're putting implants in this mouthful of bacteria.
Yeah.
Well, it's not like that. When they go to sleep and I take everything out, we clean everything spick and span. I mean, it looks like it's clean white bone. It's all disinfected. The gum disease is gone now. And we put in implants.
The bad breath goes away?
The bad breath goes away.
Right away?
It's a huge deal. That's a huge deal.
Okay.
I had a lady who came in because she was a grandmother. And she didn't really care about her partials and all that kind of thing. But she said that when her granddaughter sat on her lap, she didn't want to sit on her lap anymore because she had bad breath. That was the thing that made her change. She wanted the bad breath to go away. So what I tell patients is you get to start over. So it's, the problem with the gum disease and the bone loss and all that kind of stuff is that all you can do is maintain what's left. You're still on a house that has problems, right? But when you take those teeth out, if you're the candidate for that, you don't want to do it if they're still good. But there's a point where you got to tear the house down. But when you do that, when you make the decision, and I put all these implants in, they start over. The gum disease is gone. The infection is gone. Their breath gets better, and I see excellent bone levels and very low complication rate when we do this.
Now, I know you have a stack of photos.
Yeah.
So I'll interrupt a little bit. I'm going to rush you a little bit because I want to get
absolutely.
all these in.
All right. So this next patient, this is one of my favorite cases, actually. Most of the people who have to come in and get this done, something bad has happened in their life, and that's why I call this place Take Two. They get a take two.
That's the name of your practice,
Take two on their
right?
teeth. Absolutely. Take two on their life, a take two on their teeth. They get a second chance. So I'm very lucky to be part of when these patients take control of their life and they take their life back. And so in this particular case, the patient didn't really have access to dental care, and that's really common. He grew up in a family, didn't have a lot of money. They never got to go see the dentist, and so he has a history of.
So he probably never smiled. Like in that before photo, did you make him smile?
Yeah, he wasn't a smiley guy when he came in, and a very, very smart guy. And he came in because he got sick of his smile, and he said that he had a family history of tooth problems in his mouth or whatever. So it was really, really awesome to see the change. I mean, look at.
So what did you do for him, by the way?
He had full upper and lower implant teeth.
Okay.
Yeah, absolutely. Yeah. Things were in pretty rough shape.
That's a huge difference.
One day transformation. They get that same day 3D printed temp. We're 3D printing them in the other room. They go in and they do great the next day.
So now he can eat whatever he wants.
You can eat whatever he wants.
So he just comes in for regular cleanings, like his own teeth.
Yeah, once every year and a half, depends on how everything looks.
Nice.
Yeah, absolutely. So and he loves it. He's so excited. He got a raise. His job got better. Everything about his life, he tells me, has changed since he had these teeth done. Now I can't prove this, but I would say probably the trajectory of his entire life has changed.
Like where he ends up.
Yeah, he already told me he got a raise at his work, and
Okay.
he feels confident. He felt more confident to ask for that raise. And so, confidence is a big deal in your life, especially at a young age like that. I mean, look at him. Would you say that on the right, he looks more educated?
Yes.
Absolutely. He looks more confident. He looks happier.
It does make a big difference.
Yeah.
He's definitely more handsome.
Yeah. I had to force him to smile on that first photo.
Is that right?
Yeah, absolutely.
So they don't want to smile.
They don't want to smile because they don't want to show all those teeth. They're not happy with the way they look. When you have
He
something,
could have ended up in a denture, possibly.
that was probably the alternative.
Are there young people in dentures
Tons.
in Alaska?
Yeah,
really?
oh yeah.
Like in the 40s?
The youngest person I ever delivered dentures on was 16 years old.
Is that right?
Absolutely.
Oh my goodness.
Yeah.
So that's all behind.
That's all behind.
Do you ever, on a consult, you're talking to a patient, they're telling you their hard luck story about their bad teeth. Do you ever get excited going, they have no idea how good this is going to be?
Every time they don't know. None of them know. They don't know. You can never take them back, Randy. When I tell them, it's like when you go from a denture or you go to failing tooth, every time they go to the dentist, it's problems. The dentist makes them feel bad about their health of their bone or whatever. And it's another thing after another thing, and they just don't know what the cost is going to be. It's like that. They're insecure about what's it going to be now, what's going to cost me this time. When they get to go from that to coming in once a year, and we say everything looks wonderful, it looks great, and it's comfortable, by the way, cleanings are completely different because there's no more pain. When you have a problem with bone loss, you get the scrapings, that's uncomfortable. Sometimes they have to give anesthetic. We use no needles. They come in, their biggest concern is what to watch on TV. while we're disinfecting their teeth. And that's once a year. I have some patients it's every 2 years because they're so clean when we take them off. We're like, we don't even have to take them off. I'm just going to do a cancer screening, check everything. And so they look forward to their dental visits because they want to tell us how their life's been since they've had these teeth done.
I think you told me this. Sometimes
they're excited.
They're almost unrecognizable on the follow-ups because their charisma's back or they're acting differently.
Their entire personality changes.
Really?
They're more outgoing, they're happy, they're excited. These patients are the best referrals ever because it is so life-changing that they're sending in all their friends. They want to share it with everyone. All right, let me show you this next patient.
All right.
I love this case, by the way. He was not a complainer. He came in and he's like a typical Alaskan guy. Sometimes the teeth look like they are, they're rough. They've lived a rough, tough life.
Okay.
And not a complainer, but he decided that, he was tired of dealing with being in the dentist all the time. He wanted to change his teeth. And he was not one of those ones who says, I want them to look great. He just wanted function. But look at the difference between his face. He's a handsome guy. But look at his face after we redid that smile. It's incredible.
So now they could bite into a juicy steak or whatever.
They
There's
want
no
to eat.
limitation?
There's no limitation.
What about the front teeth? Like if they wanted to eat corn on the cob, do they stay away from it?
They can bite into an apple.
Doesn't matter.
Absolutely. Because they're bolted in. They're actually stuck to their jawbone just like their natural teeth. So dentures, the thing about dentures is they're just floating plastic. You can't
I know a couple denture wearers. They never complain.
Well, they don't complain to you because you're not a dentist. They complain to me.
Okay.
And you know what? The thing is, people don't like to talk about their tooth problems with other people. It's very personal.
Yeah.
And they hide it. They're actually ashamed of not having teeth. And so when you give them their teeth back, my goal and what I tell my patients is, I want you to forget you have these. I want you to think they're your teeth. And that's literally what they say. They'll say, they're my teeth. I forget that I even have them in there.
Now I've interviewed you for television on this topic. And a lot of these people you say have seen you for 4 years. They put it off and they put it off and they put it off and they finally do it.
Yeah. Yeah. So, I wish I saw them 4 years ago, but everybody has to do it when they're ready, right? They all mentally prepare for this. But
some of them watch it over and over.
The show?
Yeah.
I would say the average person who comes in who's seen this show, they'll say, I stayed up for 4 nights in a row to watch you because this is my exact situation that I have. Every time I go to the dentist, it's a problem, or I've been struggling with my dentures for years, and I just have been told that I'm not a candidate for dental implants, and that's just simply not true.
Now, this comes up a lot as far as cost. I guess, Medicare doesn't cover this. Medicaid doesn't cover this. I mean, even the best dental insurance really doesn't cover this. But you say there are certain...
There's some. So in Alaska, for example, if you're a state of Alaska employee and you have Aetna insurance, they'll cover actually the majority of this, so up to 80, 90%.
Is that right?
Yeah, absolutely. So we love
so
to have
Aetna,
state of Alaska, but most time dental insurance is like a $2,000 a year rebate. So, but we have financing options. It's just like if you were to go get
Are people financing this?
Most people finance it, yeah, absolutely. So, what I tell patients is if you can go qualify for a new car, okay, if you can get financing for a new car, you can get financing for this.
So you have to have okay credit.
You have okay credit.
So there are lenders.
Or a cosigner.
So there are lenders that just lend on.
Yeah, we have a couple companies we work with that have really high approval rates, and so it's a major expense, just like if you bought a car. But that's why you finance it, and so why not build that into your life and enjoy your entire. I have patients come in all the time, and they're like, "Well, I was going to get a new truck, but they choose this option." And I'm going to tell you something. This is all I do. So I see multiple patients every week to do this procedure, and I've never ever to this day had a patient. To this day, maybe it'll happen someday, that has not said it was the best thing they ever did.
And pain is not something they complain about because it seems so
No, so
painful.
you know what's incredible, and my technique has changed over the years.
Okay.
I used to see post-op pain, and actually the person who trained me to do these kind of fancy implants, he tells patients, you're going to feel like you got hit by a truck the next day. I just don't see it, and it's kind of a protocol that I know other dentists that do it, but it's not really common. But something that I show a video. We go to a 24-hour post-op video where we say, was there any pain? And about 9 out of 10 patients say they took no pain meds and report little to no pain. And part of that is we use growth factors, platelet-rich fiber, and things like that. It's our technique that we use. It's our medicines that we use during the procedure. But the key is, if you can get rid of the inflammation, you're going to get rid of the pain. And so
pain holds people back?
Patients will not do this for years because they're afraid.
Worried about the pain.
They're afraid, yeah. Well, get on my website. I have videos that'll show 24-hour post-ops of patients, and I have a little.
I saw those videos, by the way.
Absolutely,
It seems like they're exaggerating.
No, absolutely. I mean, I'm not cherry-picking these patients. The reality is, 9 out of 10. Now, there's 1 out of 10 that says, yeah, I had some pain last night, and it was a 5 out of 10 or something like that. It's, major surgery in your mouth. You shouldn't expect zero pain, but the reality is, most of my patients say they didn't have any pain.
Very nice.
And by the way, I used to tell patients, I take a couple days off work. I don't tell them that anymore. I tell them, you go back to work the next day.
Really?
Very confident in that. Absolutely. You can go back to work next time.
I'm going to rush you a little bit because I know you have a stack.
Here's another
of photos.
patient. Yep. She's a really fun case. Really bad bone loss. Teeth were loose, bad breath. The teeth were starting to fall out. Look at the transformation in one day. Now look at her. Doesn't she look younger?
She does. That's true.
Yeah, she looks younger. It's amazing how
And
much.
these are teeth you've just printed or made right in the next room, milled in the next room.
We print with the first set. We print and then we make the finals. Usually in about 4 months, we'll mill them out of zirconia, which is an incredible material.
They're strong.
They're strong. They're the best. So we only give the best.
So with
to
this
our
patient, she would have probably ended up in a denture.
She would have 100% ended up in a denture. She didn't have a choice. The teeth were coming out.
Now, is it more women than men or men?
No, I would say it's 50-50.
Is that right?
Yeah, it's pretty much evenly split.
Do you ever have like spouses, partners coming in together to do it?
My favorite case, I did 3 sisters.
Really?
Yeah, absolutely. So, but a lot of spouses and partners. Yeah, absolutely. So the husband and wife combos.
So were they all, these 3 sisters all?
What's funny? Usually the wife's smart and they send the husband in first to be the tester. We'll see how you do on him, and then we'll see, or vice versa. But no, it's really fun. I'll usually do one and then I do the other. And then I do their friend. And then, because they're so grateful. These patients are so happy. It's just an incredible, I feel very lucky.
Now, we joked before that the most expensive part about this procedure is going out to eat all the time.
That's right.
Is there some truth to
Well,
that?
actually, I have a lot of patients come and go, actually, they work a little bit too good. And they pat their belly, I got to go on a diet now because now I can eat whatever I want. Because they were, limiting what they ate. They weren't going out to eat very much, things like that. And that's a big deal, right? Being able to go out to eat with your friends is a big part of your social life. So.
What's it like when they look at the mirror for the first time?
It's tears of happiness a lot of times. Yeah, absolutely. If they're not sedated, the thing is with my patients, I don't sometimes get those tears of happiness because they're kind of sedated still when they're coming out of the procedure or whatever. But they come in the next day, they're so excited. When we give finals, I love that. It's my favorite part about this job is just, they look at themselves differently. They feel differently about themselves. See, when you go home, there's a mentality about taking your teeth out and putting them in a cup at night on your bedstand. They don't feel like your teeth. You don't feel like yourself. I have a lot of patients. This patient right here,
Let's take a look.
She's an angel that was sent to me. She was struggling with a denture and a lower snap indenture that was having a lot of lower snap indentures are a lot of maintenance. You got to replace the snaps all the time and things like that. And a lot of times patients are unhappy with them. And so she was struggling. And the other thing was she used to have a gummy smile when she was younger. She brought in a photo of herself and she had this gummy smile. She looked like Meg Ryan. And her denture wasn't made that way. And so she just wasn't quite happy with it. And she was struggling because it was always loose. So when we gave her those teeth that were stuck in her mouth, or her teeth, she said that it was life-changing for her because when she had her teeth taken out, she said she felt old. And this is the opposite. Her personality is the opposite of old. She was a hairdresser and she's retired now, but she just felt like, an old person. And so
Those look like natural teeth. In the after.
Absolutely. Well, because we were able to... The cool thing about digital dentistry, they can bring a photo of themselves 30 years ago. I can literally copy those teeth. And we can do things with implants.
So designed on a computer.
Everything is digital designed front to back. Your teeth, if you come to my practice, your teeth are made in our in-house lab. We control every single step of the process, and we do not put those teeth in until you are ecstatic about those teeth.
You say you're a perfectionist.
Big time. You want a perfectionist. Listen, you may not want a perfectionist if it's your husband or something like that, but you want your implant dentist to be a perfectionist. And I have a lot of, my assistants have to roll their eyes sometimes because the patient will be super excited about their teeth and I'll say, I'm not excited about your teeth. I'm going to redo this until I'm happy with it. I want to make another set. I go mill another set. They're always in something that's in their mouth from the time of the surgery. Very, very, very few exceptions. I've only had 2 patients that I couldn't put into immediate teeth that were stuck in their mouth in the last 5 years. Okay, and those were severe cases where there was so much big infections and bone loss that we had to do some grafting and a denture twice in 5 years. That's the truth. Because of my training and what I've done, I'm able to do the cases that most people can't do because I go find the bone. We use special...
So other dentists will send you their difficult
100%. Yeah, I get referrals a lot for this kind of thing.
We are literally out of time.
Yeah.
So, and I know you...
Hey, Randy, let me just show you 2 more cases.
Okay, I'm going to rush you.
All right, this patient, his option would have been a denture, and look what we have there. It's beautiful.
Very nice. So those don't come in and out. Everybody you're showing...
Those are their teeth. They're staying in. They can't take them out. Same thing here. He had a failing bridges and, just one thing after another, and he got tired of it. And here we go. Brand new teeth and no gum disease.
Now, you say they have to learn to smile again.
Well,
like
yeah.
they've gone so many years without
What'll
smiling.
happen is they'll mask, and in this particular case, they didn't want to show the metal when they smiled, and the facial muscles will atrophy over time. So we have to rebuild them up. So I usually will come back and take photos in a year because they've built back up those smiling muscles where they can actually smile again because they forget how to
after
smile.
a few compliments, they're starting to smile all over
they're
town.
flashing smiles, and that's a huge deal. Start any conversation with a smile and see how it changes the whole interaction. All right, here's one more final case.
All right, so the last one.
Loose teeth. Teeth are starting to come out. I mean, you can just tell. Look how much happier she looks there.
Yeah.
Having that beautiful smile. I mean, it changed
She's
everything.
young to be wearing a denture like in the before.
Absolutely, yeah.
And there's people that are in their 40s that are getting dentures.
30s. Younger.
So no dentures.
No dentures. Why destroy all the bone? Listen, in the end, here's what I find.
Okay.
The patients who they think about, and I think the worst thing you could do is say, let's ease you into this kind of thing. The patients who they've done dentures, then they go into snap dentures, then they go into finals. What you find is they end up spending more over a 10 or 15 year period than if they had just done it in the first place. They could have done it right in the first place. They preserve all the bone. Their face doesn't go away. There's nothing better for keeping bone than going into a full arch, teeth that are actually bolted in your mouth. Get that denture out of there. That thing is wrecking bone. It's making your face go away. You get to enjoy it. These patients, the implants will last longer.
Okay.
If they're under one of these prostheses than if you try to do a snap-in or something like that. So, if patients say they get tired of throwing good money after bad with their teeth, don't do it with your implants either. Do it the right way in the beginning.
Get it done right.
And enjoy
So upper and lower
the
teeth that don't come out.
That don't come out one day.
Okay. Final message.
Yeah.
2 groups. You got the denture wearer or the person that's headed to a denture. They've heard what you have to say. Maybe they've seen you before on the show, but they're still afraid. Yeah. They're still putting it off. What do you say to them?
I invite you to watch videos on my website of what it was like for these patients. They are afraid of nothing. They come in and it's comfortable. There's very little pain. You can really have teeth in a day and get your finals, usually within 4 months, sometimes less. And it can be an end of your nightmare that you've had. And that's a huge deal for patients. And if you've been wearing a denture, you forgot what it was like to be able to eat everything on the menu. And the mentality of having your own teeth again. You don't put them in a cup on the side of your bed. Don't live your life like that. Life is short.
So make an appointment. You see most patients that come in?
I see all the patients. You're going to see me. We're going to have a meeting. You get to meet me and everything like that. And we get to talk about kind of what your goals are. And I'm a huge believer in this because I have not yet to this day had one person who didn't say it was the best thing they ever did for themselves.
Now, if you had an appointment available, and I know you're busy,
absolutely.
But if somebody watching this, either horrible teeth, no teeth, could they have their teeth next week? Upper and lower teeth
I've
don't
had
come
patients who had their surgery the next day after they did their consult.
So consult and new teeth the next day.
You could.
Okay.
Yeah, you're not going to promise that every time because we get busy, but I will tell you that it's a lot faster than most people think. So don't think you need to take a week off of work or anything like that. Most of my patients could go back to work the next day. They're not on heavy pain meds or anything like that. And it could be an end of your dental problems that you're having. So, do the right thing for yourself. You really can change everything in your life with the confidence you get from having these teeth and being able to eat what you want, and just don't live your life crippled with a denture or something like that. It's not worth it.
All right. I want to thank you for coming on the show. Good stuff. You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.